Welcome to AIHA Connected, our online patient conference. My name is Erin Anderson, and I'm the Director of Programs and Advancement for the Autoimmune Hepatitis Association. I'm so happy that our next presenter agreed to speak today on a topic that comes up over and over again in our pediatric caregiver group: how to best support pediatric patients and their siblings after an AIH diagnosis. Thank you to Dr. Elizabeth Christofferson for being here today. Dr. Christofferson is an associate professor in the departments of psychiatry and pediatrics at University of Colorado School of Medicine, and she is also the clinical director of solid organ transplant psychology and kidney center psychology at Children's Hospital Colorado. Welcome, Dr. Christofferson.
For the opportunity to present to you all today, and thank you to the Autoimmune Hepatitis Association for organizing this wonderful conference. Today, I'll be sharing information about supporting children with autoimmune hepatitis and their siblings. At the end of the presentation, I hope you will have an understanding of factors associated with coping for children with autoimmune hepatitis, how to support siblings of children with autoimmune hepatitis, and also overall coping skills for the family to promote positive well-being and mental health and support healthy outcomes. Okay. So I'm going to start by discussing common emotional concerns among children with chronic illness and how individual, social, family, medical, academic factors all impact coping, resilience, and positive outcomes. And I just want to highlight this model here a little bit. This is kind of a model of psychosocial components associated with resilience among pediatric patients with chronic illness. So these are all factors that are important to consider. And while we won't cover all of them in detail today due to time, they're all associated with positive physical and mental health outcomes. And these include patient mental health and quality of life, parent mental health, family environment, and family involvement and support, positive adherence, a positive relationship with a multidisciplinary medical team, including a psychosocial team, supportive peer relationships, cultural sensitivity and treatment planning, academic neurocognitive supports, and preparation for transition to adult healthcare. We know that there are some potential emotional concerns that children with chronic illness, such as autoimmune hepatitis, may face, and I want to normalize these. You may see a range of these emotions and responses during your child's life. We may observe high stress, high levels of distress. Kids sometimes feel guilty about having an illness. They may have low self-esteem, decreased quality of life. They may feel different or alone when they compare themselves to their peers. Fear, anxiety, irritability, sadness, moodiness, sometimes embarrassment. It's important to identify these so that you can help your child. And we'll discuss some different factors that support positive coping next, starting with kind of individual level factors that can contribute to coping. So your child's baseline temperament and their self-esteem, which can be built over time, really help support their coping. Having lower levels of stress overall that are associated with the medical treatment plan is really helpful. Having a high motivation for the medical treatment, access to developmentally appropriate information about their health condition, and resilience, these all lead to positive coping outcomes. Moving on to social factors that may impact coping as well. Having an illness may impact your child's friendships and peer relationships, the social functioning of the family in terms of sometimes ability to engage in activities or feeling like it's difficult to enjoy vacations away from home or overnights with friends, or just having those certain limitations as caused by the health condition. And research shows that social support, on the other hand, really helps with adaptation and coping. So we want to make sure to build that in. In terms of family factors, we know parental support and open communication in the family, especially related to treatment, are positively associated with that adaptation to the illness and positively associated to better treatment adherence. Parent support really can buffer or reduce stress. Even children with chronic illness need those limits along with the parent support. They need behavioral expectations and appropriate discipline, and really they respond well to consistency with these limits. In terms of educational factors, while children with chronic illness may demonstrate some academic difficulties, knowing that there may be increased absenteeism, a potential for learning disorders or executive function skill deficits, we really want to work to identify and prevent these difficulties and intervene with appropriate supports. So neuropsychological assessments can be extremely helpful. When indicated, early intervention services, physical therapy, occupational therapy, speech therapies, and then of course a 504 plan for kind of the medical accommodations. And then if indicated, an individualized education plan or IEP can also be implemented at school and provide some of those accommodations that help your child specifically. It's also important to discuss some of the medical and illness-related factors that we know are associated with positive outcomes. So certain factors may confer risk, and you see these risk factors here on the left. We know that poor understanding of the illness and the treatment, conflict with the medical team, low motivation for treatment, a past history of adherence difficulties can confer risk. Conversely, we can protect against these risks by encouraging and promoting the protective factors that are on the right. So I want to highlight the importance of the medical team and hospital systems, kind of utilizing developmentally appropriate education, helping patients and families understand their treatment and their illness. Of course, that includes utilizing culturally sensitive care, considering diversity, equity, and inclusion factors, and the importance of the team really trying to understand the patient and family cultural values and perspectives. We know this is key to collaboration on treatment together. Also, having a positive and trusting relationship overall with the medical team, that high motivation for treatment, and positive past adherence promote positive health outcomes as well. And these impact overall quality of life and well-being. We want to highlight kind of ways to support adherence, since we know that having good adherence strategies supports coping. We know education and information about the illness help, and the medical team can support this by providing that education. They should also make sure to include sort of assessment of comprehension using some sort of teach-back method with the patient and family. But research shows behavioral strategies are really important too, in addition to that education. So we know that routine is extremely helpful in setting up habits. And that's true for any behavior, just like brushing our teeth, right? We do that every day. This includes other strategies like keeping medications in the same place in the house, having a system for parents, kind of setting up a supervision and checking in on when we're going to take meds and how much supervision is needed at the child's age versus having maybe an older teenager take a little more responsibility and autonomy for that. Providers can help by simplifying the regimen as much as possible. Tracking systems, calendars, written reminders around the home, and of course, apps are extremely helpful. Reward systems can be useful for all ages, even for teenagers. Parents and teens might think a sticker chart sounds silly and for a younger child, but you can really implement developmentally appropriate reward systems for teens that can be highly motivating. Chaining or combining medication taking to kind of routine cues, like I mentioned, like brushing your teeth or showering can be helpful. So doing those activities at the same time. Our teenage population, of course, love their cell phones, and even younger kids these days too. Cell phone alarms are great, and the whole family can have the cell phone alarm for medication time. Pill boxes, again, help so that it's easy to figure out what meds need to be taken when, and a lot of the pill boxes have even pop-out sections so you can take that medication dose with you if you're away from the home. We know that actually just watching the clock as a strategy is not the best strategy for adherence. So we want to instill many different strategies that I just mentioned, not just watching for time to take meds. Additionally, these factors are also associated to positive treatment adherence. So social support, family and social support, having people at school help kids and teenagers with their medications if they need to do any medical care at school, having kids be able to be open with their friends if they're comfortable, with their closest friends about their illness and their treatment, that can also help. We know that family difficulties, conflict in the family, parental mental health concerns may have a negative impact on adherence, and those are important to address. Really, the greater number of strategies for adherence that families use predict more positive outcomes. So we know that it's great to implement many strategies. And then finally, we know resilience is associated with positive outcomes. So resilience refers to this pattern of positive adaptation in the context of past or present adversity. So for instance, having a chronic illness or other stressors we may face. Resilience can be a trait that we're born with, but it can also grow over time with experience and practice. And we know there are assets that contribute to resilience. So many of them are the factors we just discussed. External forces like positive experiences from people and organizations in the child's environment. So support from others, empowerment, having those expectations and limit setting, as well as internal forces. So positive values, understanding of identity, commitment to learning and social competencies and motivation. Every family really can learn how to embrace and help a child with a chronic illness and build that resilience for that child across the family. And really, there's no right or wrong way to do this. Every family can have their own individual approach and strive for their own balance and strategies and supports for their child with the illness in order to help that child and siblings and parents all thrive and be resilient. Even though families with chronic illness, health problems may have times of fear or stress, they often also develop this internal resilience and sort of a cohesiveness that helps children and the rest of the family manage and cope together. And this can, again, help with any sort of life stressor that comes up in anyone's life. We also know resilience helps buffer against risk-taking behavior. When parents and children learn about their strengths and talk more openly and learn new ways to solve problems, it can foster this mastery and pride, and again, more positive outcomes. So I want to talk about siblings now. And we know that caring for a seriously ill child or a child with a chronic illness can take a toll on the whole family. Healthy siblings are no exception to that. We know exhaustion, stress, and uncertainty about how to kind of respond to those needs of the child with an illness can leave parents feeling guilty and can drain reserves. And sometimes it might tempt parents to sort of downplay the impact a child's illness may have on siblings. So knowing what healthy siblings are going through and taking steps to make things a little easier can help you deal with many issues before they unfold. The way siblings express their needs can vary greatly. So some may act out, some may try to be sort of the perfect child. Many will do a combination of both. Family routines and dynamics can change when one of your children is ill, and that can confuse and distress healthy siblings. There may be fear and anxiety over the illness and feelings of the loss of a kind of normal family life or their identity within the family. I definitely want to normalize these reactions that are listed here and let you know that they're not uncommon, and you may, again, see any range of them. So worrying about their siblings' health, fear of getting sick themselves, wondering if whatever their sibling is going through is contagious, guilt that they're healthy, feeling neglected or resentful of sort of special care that the sibling receives, or the time or money the family has to spend on that medical care. Sometimes siblings have more generalized anxiety about the future in general. And here are some signs that siblings may be struggling that you really want to pay attention to. So changes to behavior can signal that something's going on. And it's helpful to talk to them about how they're doing and what they're feeling. The more room kids have to express their emotions, sort of the less emotional upset and fewer behavioral problems they're likely to have. Signs of stress can include changes in sleep, appetite, mood, behavior, school functioning. Younger children may kind of pick up on the stress going on and actually have some regression of their behaviors. So doing things they did when they were younger and had outgrown, or kind of regressing back on some of their skills or developmental milestones. Even if you don't see signs in your children, you can kind of try to take the understanding that there could be stress related to the medical care, and that it's helpful to talk about what's going on. We know that family stress related to having a chronic illness, having a child with a chronic illness, can center around time, emotions, finances, and these logistics that may pull attention away from a sibling. While parents may recognize this stress, we know that research shows parents often have difficulties accessing psychological supports for siblings due to lack of time, limited resources, or financial burden. Thus, it's really important to keep certain strategies in mind. You can really try to balance the needs of your children by spending special time and developing relationships with each of them individually. It is important to be honest about the health condition with everyone, listen to the siblings' questions, and provide developmentally appropriate answers. Of course, ask your medical team for additional professional referrals if siblings need an extra level of support. Additional strategies include really being open with communication, like we've mentioned, paying attention to siblings' needs and emotions and encouraging them to talk about their feelings. Good feelings, bad feelings, any of those emotions are okay, and to normalize those. And I know this can be difficult for parents when you're feeling exhausted or stressed, when you're having to be in the hospital or medical clinic appointments. It's helpful, though, to try to set aside a little bit of time and attention so that you can let the siblings know that they're important too. Keep things normal as much as you can, trying to kind of maintain continuity and trying to treat kids equally in terms of existing rules, enforcing those rules. This helps minimize jealousy and guilt. So sending a message that everyone has the same rules. And that also sends a really strong, optimistic message about the child who has an illness and their recovery. Try not to rely on having healthy kids act as caregivers before they're really ready to take on that role, but accept their help if they're excited to be part of that medical care or routine in some way. Also say yes to help outside the family. So help with transportation, meals, childcare, other daily activities can take some pressure off of you as a parent. So you have emotional reserves to be there for your family, and you can also take care of yourself some. And you'll teach your kids a valuable lesson that accepting generosity from others is a really helpful and important thing to do. It's also okay to have fun still. So enjoying yourself, having fun with your family, stress relieving activities, recharging your battery, keeping a normal schedule of activities, trying to set aside time for your kids to spend with friends and family where you're not just focused on the illness. You can also set aside that special time with your healthy child where the focus is on them. Again, be patient with any regressive behavior. Younger kids may really have trouble making sense of their emotions sometimes. And it can be hard to be patient and attentive, but it is important. However, we don't want to let healthy kids or your child with an illness behave inappropriately or get away with behaviors that you typically wouldn't allow. Including siblings in treatment and care can be extremely helpful. So whether it's involving them in doctor appointments, connecting them to child life resources so they can have an understanding of the illness as well, giving them simple, small jobs to help out, and making sure that they feel like they can provide that kind of care for their sibling, whether it's making a card if they're in the hospital or those phone calls or video calls, all of that can help them feel connected. So finally, I want to review general health and well-being strategies really for the whole family. These can help support resilience and coping for children with chronic illness and their family members. So first, we all know the importance of healthy diet and exercise. You can support healthy eating in the whole family. If there are dietary limitations or restrictions for your child with autoimmune hepatitis, you can figure out ways to sort of modify your meals. And sometimes it might mean that the whole family eats that way. And sometimes there just might be slight modifications, but you can encourage healthy family eating for everyone. Monitoring any caffeine, encouraging meal times that don't interfere with sleep, all important healthy diet. There are also many ways to continue to engage in exercise, either at home now, these have really increased in popularity since COVID, or whether it's outdoors or in a gym. There are so many free apps with trainer-led workouts, biking, running, dancing, singing, yoga, so many different options now. It's also important to take breaks between, meetings or school or screen time and get up and move. Our bodies really need these kind of bio breaks. So we know that stress and anxiety create tension both in the body and the mind. And when we're stressed, we tend to have tense muscles. When we're in that stressed kind of fight or flight mode, we tend to tense up. It's helpful to utilize relaxation exercises to help reduce this tension in the body and the mind. So some of these are diaphragmatic breathing or deep breathing, guided imagery, guided meditation, progressive muscle relaxation. These are mindfulness-based stress reduction techniques. They're evidence-based and scientifically shown to reduce stress, anxiety, and depression symptoms. And many apps can help with these techniques and are free. You can also do simple mindfulness exercises, taking a walk, exercising, other forms of relaxation and self-care. So watching a movie, Cooking, cleaning can even feel healing to some people. Doing arts and crafts, taking a bath, other soothing activities. Or you can also just take advantage of your alone time to kind of refocus and calm yourself. I want to highlight some of these relaxation skills in a little more detail. Diaphragmatic breathing or deep breathing can take a couple different forms. One example is just doing slow counting and breathing in and out during that counting. Younger kids might enjoy this kind of basic activity. You can also just do these slow, deep breaths where you really want to breathe in through your nose into your belly. And you can explain this to little ones by pretending they're breathing in the smell of their favorite food, or breathing and smelling flowers, and then holding the breath for 2 to 3 seconds, and then slowly breathing out. And that can be like blowing out the candles or blowing on hot soup. You can also have a child imagine slowly moving a feather across a desk with their breath. So that slow and deep exhale. Progressive muscle relaxation. This is really a way to kind of relax all the muscles throughout the body, starting at the top of your head, tightening each muscle. So your forehead, for instance, kind of scrunching your face up and then relaxing it before moving to the next muscle. Kind of each muscle group or area of the body, holding it tense for about 3 seconds and then relaxing it. Guided imagery is a mindfulness activity where you're really focusing on the present. And one way to do this is to have kids focus on everything that they can presently see, hear, smell, touch, and even taste. Sometimes this can be helpful to use a guided meditation, guided imagery on YouTube or those free apps I mentioned. And there are also relaxation scripts that parents can read to kids. Distraction also can help. So name every animal that starts with the letter A, kind of I Spy type games. All of those can be really good mindfulness and relaxation activities. So in terms of sleep, we know a consistent routine is helpful for parents and children. This means consistent sleep-wake cycle, exposure to daylight in the morning, and overall exercise and stress management. This can really increase our immunity and regulate our circadian rhythms. So for parents, at least, working to get 8 hours of sleep, and for teenagers, it's even more than that. Discontinuing electronics at least 1 hour before bedtime, I know is tough, but can help promote better sleep. Making sure your bedroom helps promote sleep. So being quiet, dark, cool, and relaxing. Again, monitoring any caffeine and diet, and even just getting dressed during the day, even if it's summer or weekends or a school day, it's a cue that it's time to start the day. So the importance of family kind of coping, self-care, and self-care strategies. You've probably all heard the oxygen mask plane analogy. So you really have to take care of yourself as a parent before you take care of your family, and in order to take care of your family. This can be really tough for a lot of parents to do, and especially when you have a child with an illness, but it's really important. It also is important to do because you can model self-care and self-soothing for your child and show them how important those skills are. Help them see it's important to express our emotions in a healthy way and also utilize positive coping strategies. Positive self-talk is another way to do this. So focusing on what we can control. It could be, even though we're not feeling good, we're gonna try resting, and then we're gonna see if we can cook dinner. Kind of reframing things and trying to acknowledge something that's difficult, but then figure out a way to move forward. You can practice coping strategies together as a family. So doing those mindfulness and relaxation exercises, doing diaphragmatic breathing, reading together, exercising, of course, social events, or just taking a break. Again, just sitting and enjoying a cup of tea and inviting your child to join you or to try that themselves. As a parent, it's important to really practice compassion within your parenting. Know that you don't have to be and won't be perfect. But again, just practicing some of these strategies can really help support positive coping for the family. We also know it's important to make time for fun, for hobbies, for leisure, so activities that you can do all together. Some of those are, playing games together, going to different events together, arts and crafts, gardening, movies, anything that helps you all bond as a family. And then I want to highlight some additional tools. So positive psychology refers to the presence of positive psychological resources, such as having a positive affect, life satisfaction, overall happiness. We can all work to increase this. And that's something that can be done through therapy, but also can just be done by kind of starting to practice these values and components of positive psychology. 3 Good Things is a practice that also has scientific evidence and is based in the gratitude research. So every day for 7 days, you write down or record in this app called 3 Good Things. You write down 3 good things that happened that day and your role in bringing them about. And this practice has been shown to increase happiness, decrease depression symptoms, and has an impact even after that first week of completing the exercise. Another strategy, doing random acts of kindness. You may see stories about this on social media or the news. And we know that actually this promotes well-being in the person doing the act of kindness, even more than the receiver of that act. So really powerful. You can practice giving back to your community, being a helper. All of that really promotes well-being in yourself as well. Clarifying your values is another tool and another one that can be helpful for kids to start understanding, and especially for teenagers. So the goal here is to define kind of core values and embrace them within your work or school, relationships, and your leisure activities. And the best is when your values overlap across these different domains, across work or school, relationships, and leisure. We know this protects against stress and burnout. Finally, again, resilience is really like a muscle. It's not fixed. It can grow over time. It can grow stronger. And you and your family can all grow in your knowledge of yourselves and build upon your resilience over time in the context of having a child with autoimmune hepatitis. So the following might be signs that your child with an illness, their sibling, or anyone in the family, including you, could benefit from more professional support. If anxiety is interfering with daily life or sleep, you can't control your worries, you aren't enjoying activities, you're feeling sad or crying often, isolating yourself or withdrawing socially, it might be helpful to talk to a therapist or a professional. And here are some important resources. So, of course, accessing through your social work or psychology team at your hospital or clinic that your child is seen at, asking family, friends, any medical providers for recommendations on therapy referrals. You can call your insurance company or look online at their list of approved providers. And certainly national organizations like the American Psychological Association, Psychology Today certainly is a helpful search engine for this. And then it's important to know about these crisis chat and text hotlines that are available 24/7. The National Alliance on Mental Illness is another helpful resource. So I hope you and your family are really able to practice some of the coping strategies and skills that we discussed today to promote positive well-being and quality of life. Thank you for your time today, and please feel free to reach out with any questions.